You are watching a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 25 years, please visit www.aapcho.org.
So in terms of governance, we are so fortunate at the Waianae Coast Comprehensive Health Center to have one of our consumer board members be the chair of the NAC board. Kuila Clark has been part of Waianae Comp for over 20 years. And to have him at such a high level at NAC is an honor and a privilege and of enormous benefit to the health center. So governance, we have a very active, strong consumer board. In terms of research, we have both a research committee and our own IRB. We have consumers on both the IRB and the research committee, and they have been instrumental in not only focus on the areas of research that are of importance to them, but also to ensure that they don't have a feeling that their community members are being in any way exploited. In terms of payment reform, we have listened to our patients, our consumers, in terms of developing supplemental patient healthcare home standards, in addition to the NCQA standards that have been put forth nationally. By adding these are standards that reflect the work that we at a community health center do. And again, it all pertains back to the patient. Patient-centeredness too often is defined by the so-called experts, the medical providers, the researchers. Rarely do we actually listen to the patient's voice and to what's important to them in their patient-centered healthcare home, and we have made an attempt to do so. Waianae wouldn't be Waianae without the level of consumer engagement. Fundamentally, we are a community health center established by the community and for the community. Patients play an active role in everything that we do, from developing our payment reform plan to doing the research that we do to being a voice in the state, not just the community. Patients and consumers are the heart of what Waianae does. The risk would be that we wouldn't be Waianae. We would lose all perspective in terms of the work we do. We would be provider-centric rather than patient-centric. The voice of the patients is what drives all that we do, all the care we provide, all the research we do, and patients drive what community health centers are about. Communities, you know, it's part of the title of a community health center. We were established by communities and we serve the community. Without listening to the patient's perspective, we wouldn't be what we are.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.com/AAPCHO and tune in for our next podcast at www.aapcho.org.